So now we will talk about what these cranial nerves do. Cranial nerve 1 is also known the olfactory, is a visceral sensory. All it does is for sensation of smell. Cranial nerve 2 is a somatic sensory. It's called the optic nerve. It's a somatic sensory only involved with vision, seeing. Cranial nerve 3 is the oculomotor nerve, and it's has two components: a somatic motor, in which it's responsible for the movement of the eye, specifically the superior, inferior, and medial rectus muscles of the eye, as well as the inferior oblique muscle of the eye. And a visceral motor component is responsible for it gives off parasympathetic branches that will innervate the muscles that control the diameter of the pupil, specifically the circular muscles, whose contraction makes the pupil smaller, constricts the pupil, and also to the muscles that control the shape of the lens. Okay, that's the ciliary body that controls the shape of the lens. So that's the visceral motor component of cranial nerve 3. There is also a sympathetic branch, perhaps also from cranial nerve 3, that innervates the outside layer of the iris, which consists of radial muscles, and their contraction would cause dilation of the pupil. The pupil increases in size. Next is the trochlear nerve, cranial nerve 4, and the abducens nerve, cranial nerve 6, both of which are somatic motor. The trochlear controls the muscle called the superior oblique muscle of the eye, whereas the abducens nerve controls the lateral rectus muscle of the eye. The cranial nerve 8 is the vestibulocochlear nerve, and it's a visceral sensory involved in sensation of balance and hearing. So this would be innervating the inner ear, the vestibulocochlear apparatus within the inner ear. Cranial nerve 11 is a spinal accessory nerve. It's only a somatic motor, controls the muscles called trapezius, as well as the sternocleidomastoid muscles. So for example here, this is the sternocleidomastoid and this is the trapezius muscle. And cranial nerve 12 is a hypoglossal nerve, it's a somatic motor, controls the muscles of the tongue, the extrinsic and intrinsic muscles of the tongue. So here is the tongue. These muscles here are extrinsic, involved in movement of the tongue, whereas the muscles within the tongue that change the shape of the tongue, those are the intrinsic muscles, both of which are innervated by branches of the hypoglossal nerve, cranial nerve 12. Now we will talk about cranial nerves 5, 7, 9, and 10, which are most complicated ones. Cranial nerve 5, the trigeminal nerve, consists of three components: the V1, V2, and V3. V1 is known as ophthalmic, V2 as maxillary, and V3 as mandibular. V1 and V2 both have a somatic sensory component and a visceral sensory. The visceral sensory, so here is a picture of a tongue. This is a tongue, and that's the valid papillae. We won't talk about the anatomy of the tongue yet, but this area behind the valid papillae is the root of the tongue, and this is the body and the tip of the tongue. V1 and V2, the visceral sensory component, is involved in general sensation of the anterior two-thirds of the tongue, this area. By general sensation I mean pressure, pain, and temperature here. The somatic sensory component, here is a face. The V1 controls the pressure, pain, and temperature felt in this area here. That's why it's called ophthalmic. It's in the area of the forehead and between the eyes, the nose. And V2 is the pressure, general sensation, pressure, pain, temperature in this area here, the maxillary area.